Today we will be talking about Gamekeeper's thumb. The anatomy for Gamekeeper's thumb is the extensor pollicis longus and brevis, abductor pollicis longus and brevis, flexor pollicis longus and brevis, oppens pollicis, adductor pollicis, palmar interossei, and the ulnar collateral ligament of the metacarpophalangeal joint. Not all of these muscles are directly impacted, but because the thumb is damaged and cannot do certain actions, they are all affected in some way, shape, or form. The only bony anatomy of this is the first metacarpal and the first phalanx. There's two different types for this injury, chronic and acute. Chronic is caused by repetitive valgus force causing damage to the ulnar collateral ligament, and acute is from an extreme force such as falling onto your ski pole while holding it, as shown in the picture above. There's three different grades. Ligament is stretched in grade 1 but not torn. Grade 2 is a partial tear, and grade 3 is a complete tear. Mechanism of injury is just repetitive valgus force for the chronic injuries, and acute is extreme. Signs and symptoms are bruising, inflammation, pain, and tenderness. Special tests are valgus stress test, pinch grip test, X-ray, MRI, and radiograph. To get a true diagnosis of what this is, it is almost always recommended to get a radiograph on it. Some predisposing factors are any previous injury to your thumb or ulnar collateral ligament of the thumb, or any repetitive valgus force that you put on the thumb. Some differential diagnoses of this is tendonitis, Stenar lesion, or avulsion fracture. To manage this, you would immobilize it, surgery depending on the grade, and then you'd go through therapy to help with rehabilitation. There's three different types of splints that you would use, and you would immobilize the thumb for 4 to 6 weeks after the injury or after you have surgery if the injury is that severe. The first one is the Thumb Saver MP, which is shown in the top. The second one is the Fixed Comfort Thumb Brace, which is the middle, and Easy Fit Thumb Spica Splint, which is the third one. To prevent this, you should learn proper technique for whatever sport, such as skiing, since it is the most common for acute injuries, and then you should avoid repetitive valgus stresses on the thumb. There's no mulligan. These are my references, and this is my peacock.